The Health Watch with Dr. Syed Hussain from Trinity Health of New England. All the different things going on in the world of medicine to talk about. Good to see you again, sir.
Likewise.
Yeah, glad to have you here. Starting first with an artificial sweetener called erythritol. The Cleveland Clinic said it's been linked to blood clots, heart attacks, stroke, things like that. I know sometimes in the news we use the word linked to do a lot of work, meaning maybe there's a tenuous link. This one looks like it's a fairly robust link.
Yeah, this is a chance discovery that researchers came across, Tim, and there needs to be more research into this, but what basically, in a nutshell, this is it's erythritol, which is an artificial sweetener. It's a naturally occurring substance that's manufactured artificially in large quantities to be able to sweeten certain foods. And the study found that there was a higher risk in individuals who already have underlying health issues that increase their risk for either heart attack or stroke, such as diabetes and high blood pressure. Those people, when taking erythritol, actually had a twofold increase in heart attack or strokes, which is concerning because these are people that are already at risk. And so there was additional studies that were done that indicated that platelets, which is present in blood, were actually clotting at a higher rate in patients who have higher levels of erythritol.
Yeah. Something to keep in mind. Is there anything actionable going forward?
So there's more research that is necessary, but suffice to say, if you are one of those individuals that are higher risk because of underlying medical problems, it's safe to stay away from this till we find out more about this substance.
Okay, let's talk about the RSV vaccine. In this case, I think the Food and Drug Administration advising the CDC to approve one for people aged 60 and up. We're not talking about infants. What do we know about that? How effective could a dose of that be?
That's correct. There's only the first step in this long process that has just been, we just finished, which is approval from an advisory committee, goes to another committee today. Basically, it will reduce the chances of moderate to severe infection in individuals that are above the age of 60. We know, for instance, there are a little under 200,000 infections in this age group from RSV annually, along with 14,000 deaths. So anything that can be done to prevent this would be a welcome development. But additional research is needed on the safety angle, which Pfizer will be conducting prior to the May approval by the FDA, followed by CDC soon after.
Okay, lastly, I want to talk about Shigella, an infection that can cause shigellosis, if I'm saying that right. I've heard of it before. It's a bacterial infection, but it looks like maybe there's a drug-resistant strain of that is either developed or one that we knew about has become drug-resistant?
Yeah, it's increasing over the years, and this is all related to antibiotic stewardship, Tim, and by that I mean the appropriate use of antibiotics. We've seen over the years higher number of drug-resistant bugs that are coming up. Basically, Shigella will cause self-limited disease in a majority of people. It can cause diarrhea, fever, abdominal pain that resolves, but in a very small subset, they might be on antibiotics and their symptoms may not resolve. That's when clinicians have to be on guard to say, okay, is this something else that I need to report to the state, and need to keep that in mind when they're treating patients.
Is there a basic best practices for when we should be using antibacterial products, things like soaps, things like that?
So washing your hands with soap and water is first and foremost, because this is one of those infections that can be caused by improper hygiene. So practicing those public health measures that we've all talked about over the last few years is paramount.
Yeah, my understanding is it can transmit fairly easily.
That's right.
Yeah, Shigella, it's been around for a long time. It's not new, but it's made its way back into the news. So thanks for giving us an update on what we know,
Absolutely.
Doctor. Good to see you.
Likewise.
Remember, Dr. Syed Hussain every single Wednesday here to talk about what's going on in the world of medicine, and we appreciate the knowledge.
Thank you.
Thanks. Good to see you again.